So let's complete perception with otic therapy. The most common middle ear disorder is otitis media. It is a bacterial infection. It most often occurs in children, and it usually follows an upper respiratory infection or is accompanied by an upper respiratory infection. It occurs more so in children because their eustachian tubes are shorter and straighter, so the bacteria has easier access to the middle ear. Otitis media is the leading cause of conductive hearing loss in children. It must be treated aggressively so as not to damage the hearing of the child. Antimicrobials are the systemic first line of defense. Oral amoxicillin is the most common antibiotic for otitis media. There are some advantages to ototopical antibiotics, and that they have a higher concentration that's delivered directly to the site. Topicals sometimes do not usually cause systemic effects, and they're usually more economical. Disadvantage to ototopical antibiotics is that they may not be effectively delivered if there is any kind of cerumen or drainage or discharge in the ear canal. They may exert local toxicity and local hypersensitivity reactions. Ciprofloxacin is a fluoroquinolone that's used as a ototopical antibiotic. Some of the adverse reactions are application of site pain, fungal ear superinfection, and headache. Ciprofloxacin has minimal to no systemic effects. Anti-inflammatory agents or steroids are combined with antimicrobials many times to treat otitis media. Whenever there is any kind of infection, there is an inflammatory response. That's just the body's way of trying to deal with it. And this can further hinder hearing and transportation of the antimicrobial into the middle ear if there is some inflammation. Sometimes anti-inflammatories also help relieve pain as well. Local anesthetics like benzocaine are commonly used. They relieve the pain, they help relieve the swelling and the congestion associated with otitis media. They have no antimicrobial properties. They can also be used sometimes to soften the cerumen for easier removal of it. Wax emulsifiers help loosen and assist in removal of the cerumen impaction. The best prevention of cerumen impaction, though, is to never use cotton swabs in the ear. Wax emulsifiers are used when wax builds up in the ear canal and it blocks conduction of sound through the middle ear. It can be a medium for bacterial growth then, and the manifestation is typically just decreased hearing. A common wax emulsifier that is used is carbamide peroxide, which is Debrox. It's an over-the-counter emulsifier that's most commonly used for cerumen impaction. It should not be used if the ear has drainage or discharge, if there's ear pain, irritation, rash, injury, or tympanic membrane damage. It is not systemically absorbed. It is contraindicated for people with tympanostomy tubes or who have ear surgery within the last 6 weeks. Again, with anything, you must assess for allergies. Otics should be administered at room temperature. For children 3 years or people 3 years and older, you have to pull the pinna up and back to administer ear drops. And for children less than 3, you have to pull the pinna down and back. Those are just some of the reminders for you. That concludes perception of eyes and ears. Very simple, very basic.